Good afternoon, everyone. Welcome to my paid Dr. Rekha Segal Homeopathy for Mankind. As you all know, I am uploading my videos on female related problems. So, my today's topic is amenorrhea. So, let's start. What is amenorrhea? Amenorrhea is a condition in which the female is unable to menstruate. That means she is not having her regular cycle. It is not a disease. It doesn't mean that you are infertile, but it is a condition which needs a medical intervention. And our aim is to find why there is no menstruation. Now, before describing the types of amenorrhea, a brief description about the hormones which are involved. As you all know, the pituitary gland, which lies in the brain, releases two main hormones, that is FSH, follicle stimulating hormone, and luteinizing, that is LH hormone. These two hormones influences ovary to secrete two main hormones, that is progesterone and estrogen. When the level of estrogen increases in the female's body, it marks the reproductive phase, that is puberty. These two hormones controls the cyclical changes in the uterus. Now, the types of amenorrhea. First one is the primary amenorrhea. It is a condition in which the female is not menstruating till the age of 16. Remember, till the age of 16, please do not jump into any medical intervention. Just wait patiently till 16. Usually after 16, if the female is not menstruating, there could be the structural or any genetic defects are involved in these cases. It could be Turner syndrome, it could be androgen insensitivity, or it could be the structural defects in the uterine structures. And these cases are bit difficult because they need a surgical interventions and their recovery is also very slow. Now the second one is the secondary amenorrhea, in which when the female used to have a regular cycles from past 6 months there are no menstruation cycles, or she is having a history of irregular cycles but from last 3 months she is not having a cycle. Remember, one missing period is not amenorrhea. Now, as you all know, that in our female body, there are some markers where we don't menstruate. That is before puberty, pregnancy, lactation, and menopause. So, these natural physiological causes should be excluded before proceeding for the case. Now, what are the causes? Why I am discussing the causes for secondary amenorrhea in depth? Because they will be a highlighting point in your case taking and they will narrow your diagnosis. Your approach toward the case will be a different. Now, first one is the stress. As you know, this is a very common ailment, and while taking the case, you have to assess the mental status of the patient, because usually I have found in many cases the patient give you a history that I'm having a fright, that's why I'm not having the amenorrhea, or there could be a worry or a grief, any kind of exams phobia or fear. These could leads to amenorrhea. The second one is the low body mass index, that is the low body weight. If the child is underweight, that could leads to a nutritional amenorrhea. So while taking the case, you need to have a good description about the kind of the diet she is taking. There could be a nutritional deficiencies which are leading to amenorrhea. The third one is the history of medication. What kind of medication she is taking? If she has taken antihypertensive, anti-allergic, steroidal, oral contraceptives in childbearing age, these could inhibit ovulation and thereby resulting into the amenorrhea. And they have to be taken consideration during the case taking. The fourth is any uterine defects or any uterine ailment, that is PCODs, that is polycystic ovarian disease, or endometriosis, adenomyosis indirectly influences the hormonal levels of the body and thereby resulting into the amenorrhea. The kind of previous illness, any uh, long illnesses such as jaundice or typhoid or anemia could leads to amenorrhea. Why I am describing these details, because in your case taking it will narrow your picture of the diagnosis and you will be able to give rise to a conclusion very easily. The seventh is very important is your while taking the case history, the kind of lifestyle, which is a very important part, because I have seen in many cases the lifestyle is responsible for these kind of amenorrhea. There could be a sleep patterns are very different, or eating patterns, either they are eating very much or they are eating in a very low quantity or in a very less quantity. So you need to have the thorough investigation about the lifestyle of the patient. In the amenorrhea, these causes is to be inquired. While approaching the case, if you will take these things into the consideration, your picture for the case will be very clear and you will be able to select the minimum in a faster pace. Now, the homeopathic part, which is also a very important part. As you know, there are ample amount of medicines which can be for amenorrhea, but I am discussing 4-5 medicines which are very important and could give a better results. The first one is pulsatilla. As you all know, I always say this is one of the females friendly medicine. It is there in it is used in every aspects or every ailments of the female, and usually in these cases the pointers for prescribing pulsatilla is that you will have a history of delayed menses or they are never been well since puberty. Their mental picture where there is very mild delicate constitution and no local pathology is involved. The second one is the sepia. It is a very good remedy for amenorrhea, usually during the childbearing age, and there will be a history of irregular cycles, or usually after lactation when the periods doesn't occur. This remedy works wonder. The third one is lycopodium. Lycopodium is a very good remedy because in this you will find that mentally the female is very sharp, but when it comes to the body, the physical part, they are underdeveloped. So while taking the case history or examination, you will find the secondary sexual characteristics are less developed. The fourth is a kalika. It is one of the very important remedy for the amenorrhea. Along with this problem, you will have the backache issues, the weakness, and the digestive problems will be evident in the case. The fifth remedy is a very important remedy. That is senecio. It is a very good remedy for the cases where there is amenorrhea or the female is not having the menses from past 3 months or 4 months. It is usually prescribed in mother tincture and have given a wonderful result. So these are the remedies which can play a very important role while prescribing in your case taking or giving the results. But for these in amenorrhea cases, you need to have a detailed case taking. A detailed case taking is very important because we will come into the conclusion what kind of the problem which is there, which is responsible for this kind of amenorrhea. I hope this video will be informative to you and will give you a good knowledge about the amenorrhea. So stay healthy, stay happy and enjoy homeopathy. Thank you.